The Pacific Islander Diabetes Prevention Program, PI-DPP, is a year-long evidence-based lifestyle change program recognized and supported by the Center for Disease Control and Prevention, the CDC. PI-DPP was formed through a partnership between the Association of Asian Pacific Community Health Organizations and the Pacific Islander Center for Primary Care Excellence, as a project funded by the CDC DP-17-1705 grant to scale the CDC national DPP in underserved areas. Currently, PI-DPP consists of 11 sites throughout the U.S. and U.S.-affiliated Pacific Islands. Aligning with DPP success standards, participants aim for 5% body weight loss, 150 weekly physical activity minutes, and lower HbA1c values. Listen in each week as we highlight PI-DPP sites. Mililani Leui, Program Manager of PI-DPP, sits down with site representatives to hear about their community stories and program impacts. This week, we spoke with Saram Salle of the Chuuk Women's Council CWC. CWC is the umbrella organization for 64 individual women's organizations in the state of Chuuk, located in the Federated States of Micronesia. In this episode, Mililani and Saram speak about the importance of adjusting the program to the community's specific needs and CWC's hopes for bridging access to Chuuk's municipal islands.
My name is Saram Salle, working for the Pacific Islander Diabetes Prevention Program as a lifestyle coach and as a data specialist and assistant for the coordinator.
My name is Mililani, and I am the Program Manager for the Pacific Islander Diabetes Prevention Program. So why is a program like this important for the communities you serve?
Community that is in the process of changing society needs guidance to adapt to its changes. And Pacific Islanders Diabetes Prevention Program is one solution that can help the community understand and apply what is being taught. A program like the prevention of type 2 diabetes has many values for the communities in Chuuk. Chuuk is known to have the highest number of NCDs or non-communicable diseases in the FSM, and type 2 diabetes is the common one among our fellow Chuuk. Type 2 diabetes is one of the leading causes of death here in Chuuk. To limited knowledge on healthy eating habits and the importance of exercising. The program itself is like an eye-opening technique for the communities to realize that the lifestyle we are living is the root cause of having NCDs, most especially type 2 diabetes. So the program's curriculum, which the lifestyle coaches use, is very informative and relatable to what most islanders are going through in their daily lives. For example, most of us are relying on imported food, but we tend to ignore our own fresh and healthy food. Eating more of the imported food that we are not familiar with the processing of it, or we don't really understand the contents on the packages. This program has helped many participants of PI-DPP get the idea to read the contents on the food packages and to know which imported food can be healthy or good for serve. This is basically why a program like this is very important to our community.
Why is it important to tailor the program to your community's specific needs?
Most things are easier if they are fixed or designed the way a community would easily recognize or be familiar with. New things tend to make it hard for people to understand, so it is important to adjust the program just to best suit the community's specific needs. It is important to make some changes within the program because the program cannot move forward if the people do not understand what you are giving them. For example, in the curriculum, there are foods that they use as examples, and we change them to something local or what they are familiar with or they have it in their community so they can know the benefits and can easily access it. That way, they can stay healthy, have access and identify food in their communities and be able to achieve their goals. Not all the communities that we go to have the same needs. Some they need motivations and someone to guide them. Some need the right materials or equipment to get on with healthy living. Some just need to start from scratch because they have no idea that there are many ways to live a healthy lifestyle. Most our participants are homesteaders and they are not really exposed to what others experience when they go to work or go to school. That is why it is important to adjust the program to our community's specific needs.
Is there any background information you would like to share to reinforce the importance of this program for your community?
So Chuuk State is consisted of 41 municipal islands and are scattered in and outside of the lagoon. Our means of transportation is through small boats and small ships, and the hospital is located on the main island, water. People from the other islands are not really accessible to the services. We are hoping this program would expand with more funding to take it to the other small islands that are scattered in and outside of Chuuk.
So, what impact has your site had on the communities you serve?
There are 350 screen and eligible participants. 66 of them lost 5% body weight, 8 reduced 4% of their weight. Then that's 5.11% average percent of body weight loss per participant. 402 minutes average for physical activity minutes per week per participant. 54% completed and we reduce risk of having diabetes. There's a total of 421 classes delivered from this program.
What are some of your site's challenges and/or best practices for recruitment, retention, and general programming?
Challenges that we have is the high turnover of staff because of personal reasons. Another challenge was the inconsistent and poor data collection and putting of participants' information. Another challenge is resources. We don't really have the A1C plus blood test kit, and it made it difficult for referrals from both public health and Chuuk Community Health Center. That's why we have low referrals from our partners from the clinics and the hospitals. For the best practices, I think having a lot of events going on helps the participants get active and always coming to classes because of a lot of events that we do and activities.
What future projects and/or goals does your site have for advancing diabetes prevention and promoting healthy lifestyles?
Increase home gardening, store farms for the participants to have access to healthy food, and create more events that help people do more physical exercises like our monthly trashathon and walkathons and hikes.
We thank Saram from Chuuk Women's Council for speaking with us during this week's segment. Please stay tuned for our next site highlight.